Welcome back to the Explainer, everyone. Let's jump right in today. I want you to just look around you for a second. The world isn't made of perfect squares and smooth circles, is it? Today, I am incredibly excited because we're going to undergo a complete mind-bending paradigm shift regarding how we view the geometry of the world, and more importantly, your health. We're going to explore the geometry of the rough.
So let's start with a seemingly simple question. How long is the coastline of Britain? I mean, it sounds like a basic factual question you could just look up in an atlas, right? Well, in 1967, a mathematician named Benoit Mandelbrot realized that the answer depends entirely on the size of your ruler. If you measure with a kilometer-long stick, you're going to miss the little bays. Use a meter stick, and you trace those bays. Shrink your ruler down to a centimeter, and you wind into every single pebble and crab hole. Every time you shrink your ruler, the coastline actually grows. It's a completely mind-bending truth. The coastline isn't a simple line. It's a fractal.
Okay, let's dive into this. Part 1, Geometry of the Rough.
To really get this, we have to look at how we've all been taught to see the world. For most of recorded history, the Euclidean geometry we learned in school has been our default language. We're taught to think in terms of smooth surfaces and whole dimensions. You know, a line is one-dimensional, a square is two-dimensional. It's tidy. But the reality of our natural world is completely different. The natural world is rough. It repeats. It absolutely does not fit into those perfectly smooth boxes. For centuries, we basically treated the roughness of the real world as noise, or kind of like an error in our measurements, and we just tried to average it away to find a smooth signal.
But Mandelbrot made an observation that shifted everything. To paraphrase his famous idea, clouds aren't perfectly round spheres, right? Mountains aren't perfect cones, coastlines definitely aren't circles, and bark isn't smooth, nor does lightning travel in a straight line. Mandelbrot proposed something revolutionary. What if this mathematical irregularity isn't just noise or a mistake? What if it's actually a completely different, wilder kind of order?
And this brilliantly illustrates the three core properties of a fractal. First up is self-similarity. A fractal looks roughly the same at different scales. Like if you zoom in on a piece of Romanesco broccoli, each tiny floret is literally a miniature copy of the whole head. Second is scaling. Because the pattern repeats, your measurements entirely depend on the scale at which you make them, just like that coastline we talked about. And third, and perhaps the most mind-bending of the whole shebang, is fractional dimension. A shape can literally live between dimensions. A coastline is way too wrinkly to be a 1D line, but it doesn't fill up space like a flat 2D square either. So the coastline of Britain has a fractal dimension of about 1.25. No way, right?
Now, it's worth noting that Mandelbrot didn't discover these shapes completely out of nowhere. The math has older roots. Back in 1904, Helge von Koch constructed a snowflake shape with infinite perimeter but finite area. Václav Sierpinski mapped out repeating triangles in the 1910s. Gaston Julia explored complex repeating functions in 1918. But for decades, mathematicians were practically terrified of these shapes. They dismissed them as monstrous, pathological curiosities that broke all the rules. It wasn't until the 1960s and 70s that Mandelbrot, using early computer graphics, synthesized the field, named them fractals, and finally made them visible to the rest of us.
Moving right along to Section 2, the fractal body.
Let's shift our scale down to the microscopic level. Every living organism has a massive design problem. Living tissue needs huge amounts of surface area to exchange gases and absorb nutrients, but it has to pack all that surface area into a very bounded, tight volume. So how do you pack 70 square meters of lung surface area, which is roughly the size of a small apartment floor, by the way, into a melon-sized chest cavity? The answer is recursive branching. The trachea splits into bronchi, which split into smaller bronchioles, repeating for about 23 generations until you reach 300 million tiny alveoli. The human lung is a perfect fractal.
Now, what's really interesting here is that this fractal nature isn't just in our anatomy. Actually, scratch that, it's not just physical structure at all, it's the very rhythm of our survival. We intuitively think a healthy heart beats steadily, like a metronome, but it doesn't. A healthy heart has immense, self-similar variability in the intervals between beats. It fluctuates like a coastline. As a heart becomes deeply sick or approaches catastrophic failure, it paradoxically loses that complex fractal rhythm. It becomes smoothly regular. Health, it turns out, is highly irregular.
We also see this same thing in pathology. Cancer is fundamentally a disorder of geometry. A healthy tissue's blood vessels branch in a beautifully regulated, evolutionary fractal way. But a tumor grows differently. Tumor vessels are hijacked and messy. They branch chaotically, which literally alters their fractal dimension. Modern medical imaging actually relies on calculating these altered fractal dimensions to teach machine learning classifiers how to distinguish a benign lesion from a malignant tumor. It's an absolute game changer.
Let's see how this builds as we zoom out in Part 3, Epidemics and Fractal Cities.
So let's zoom out from a single body to an entire city. Epidemics, like COVID-19 or SARS, do not spread in a smooth, uniform wave. The transmission tree branches, but it branches super unevenly. The vast majority of infected people might pass the virus to 0 or maybe 1 other person. But a tiny minority, the superspreaders, might infect 20, 50, or even 100 people at a single event. Epidemics branch fractally through highly skewed superspreader events. The geometry of the transmission dictates how we should actually fight the disease.
And this changes absolutely everything about how we view urban risk. A lot of standard epidemiological models expect disease to spread like a smooth wave across a perfectly planned, homogeneous grid. But look at informal urban settlements, like the slums on the edges of Nairobi or Lagos. They are organic, recursive, and totally fractal in their layout. Narrow lanes branch into narrower lanes. Water networks cluster irregularly. Outbreaks like cholera spread exactly along those informal, fractal lines. If you try to model that risk like a smooth temperature gradient across a map, you are going to get it completely, dangerously wrong.
So, how do we fight a fractal threat? Well, with a fractal defense. Health systems themselves must be designed as hierarchical fractals to effectively deliver care. Look at Ethiopia's health extension program, for instance. It branches from a central ministry down to regional bureaus, down to the Wareda, to health centers, to health posts, and finally to individual households. It is self-similar at every single level. The success of a health system heavily depends on getting these branching ratios right, because if the ratios of supervisors to workers break down, the entire fractal stops functioning properly.
Which brings us to Section 4, the problem with averages. So the crucial point here is a massive shift in how we need to think about data. During an epidemic, we often hear about the average reproduction number, or R. A national average of R equals 1.0 sounds perfectly neutral, right? Steady state. But that single smooth average can dangerously mask a fractal reality. That 1.0 might actually be made up of an R of 0.5 in one region, where the virus is dying out, and an explosive R of 1.5 in another region where it's tearing through the population like wildfire.
Relying only on averages commits what we might call the violence of smoothing. Averages collapse the complex truth of the population. Reporting only the mean is exactly like measuring that jagged coastline with a rigid 1-kilometer ruler. You smooth away all the little wiggles that actually represent the reality of the situation. In a fractal world, the variance isn't just the noise you ignore. The variance is the signal itself.
Let's wrap things up with Part 5, Designing for the Rough.
So what does this all mean? How do we actually apply all of this on Monday morning? Well, here's what you should take away. If you're a clinician, stop ignoring variance. A patient's wildly swinging glucose levels are vital data, even if their average looks totally fine. If you're a researcher, you absolutely must sample at multiple scales, because a finding at the community level might not translate perfectly to the regional level. If you work in policy, understand that informal pathways and relationships are part of the system's true geometry, not just deviations to be fixed. And finally, for those building AI, beware of training your predictive models on smooth average assumptions. When you deploy smooth models into a rough, fractal world, they will structurally fail where the roughness is highest.
I want to leave you with the exact thought we started with. The world refuses to be a single, perfectly smooth number. Whether it's the shape of your lungs, the rhythm of your heart, or the spread of a virus in a city, the truth is rough at every single scale. Our job isn't to smooth that honesty away. Our job is to look closely at it. So, the next time you're looking at a set of data, a health outcome, or a complex human system, I want you to ask yourself, what size is your ruler?